I just met with Catherine Hunt. She's the genetics counselor here at Mayo. And the purpose of that meeting was I wanted to get an understanding of whether there was any genetic risk, not only for myself, but I have 3 sisters and 2 brothers and lots of nieces and nephews and my own son and daughter. It was interesting, and I'm so glad that I did it. And I'm really struggling here because I don't quite know where I'm going to go yet after receiving all of the information. I thought that this was really honestly going to be an exercise, that I had no risk, because when you look at my dad's side of the family, other than my father, there's no cancer anywhere, and the men and women lived well into their late 80s or 90s. Now, to prepare for this meeting today, I had to do some research, and I talked with my mom and got some more information on her side of the family, and found out that, which I knew previously, that a cousin had breast cancer. But in addition to that, a great aunt and a great uncle had cancer, and the kinds of cancer they had was pancreatic and stomach cancer. And I was totally unaware, but pancreatic cancer specifically is related to breast cancer. So that was a risk factor I didn't know that I had. And then what was explained to me is this stomach cancer may have simply been something that's how families refer to it, because it wasn't a specific diagnosis, or ovarian cancer. The onset is so quick and unfortunately death so rapid that maybe that could have been in it. So I have to do some more research, because those 2 factors do increase my risk level. So where do I go from here? The question I have to answer is, do I get tested? And it may not be covered by insurance, because I'm not in the category that this is definite get tested. You have sisters with cancer or those kinds of things, so it's not a certainty. Just want to bring you up to date. I'm 2/3 of the way through chemo, so I have 2 more to go, and am still doing remarkably well. I've got to be honest with you, though, it's each chemo treatment, each part is a different journey. I guess I had expected, once I got through the first one, that the second and the third and the fourth that I would know what to expect. But one of the things I've learned is each time really is different. I had probably my toughest weekend this past weekend. Just didn't have energy at all, but I think the beauty of it is you get past the weekend or those few days, and I'm feeling much better today. But since we last met, I just want to tell you one other thing, because this is something that was a concern for me going into chemo, and it's an issue of getting a port. They had talked to me about getting a port because that would mean not having to use the veins, and it's a direct way to get the chemo in the body and a direct way to do blood draws. And my thought was, unless I had to get it, why put myself through another surgery? So I elected not to do that. Unfortunately, my veins decided halfway through this they didn't feel like playing anymore and didn't want to cooperate. So they had actually started to scar up, and rather than risk permanent effect of my left arm, it was time for me to get the port in. And why I'm telling you and want to tell you about this is my fears were really not necessary. You do go through general to get it put in, but getting it put in was quick. Recovery was fast. I had a party 2 nights later, and I was good to go back at work on Monday.